Hi, my name is Amber Plata. The career I want to pursue is a physician assistant. In this career, there are many ethical dilemmas one must come in contact with. In this presentation, I have researched an ethical dilemma that physician assistants come into contact with many times throughout their career. A physician assistant is a healthcare professional who practices medicine as part of a healthcare team with collaborating physicians and other providers. Physician assistants can also practice and prescribe medication to patients. PAs make around $50 an hour and about $98,000 annually. Physician assistants are able to function in many specialties across the medical spectrum, as well as being able to diagnose and treat illnesses, take medical histories, and order and interpret laboratory tests. The entry level to enter a PA program is a bachelor's degree. Overall, it takes roughly 6 years to become a physician assistant. The ethical dilemma I chose to research is, should patient records still be confidential even when a healthcare executive thinks that life-changing results or treatment should be shared with someone close to the patient? In my opinion, medical records should not be shared with anyone the patient has not approved. Unless the patient is conserved by the state, medical records must always be kept confidential. Even if I thought it was in the best interest of the patient to share their medical records, I would abide by what the patient wants and respect their decisions. I think that patients know what is best for them and their situation, and whether sharing or not sharing their medical records regarding life-changing treatments and results is in the best interest of themselves. Doctors are bound by a contract to keep their patient medical information secure, no matter what, their own opinion. It is a condition of registration to abide by medical counsel guidance, which includes a requirement to respect patient confidentiality. There are also requirements under the Data Protection Act to keep personal data, including patient medical records and information, secure. Giving people access to one's medical records without their consent is a violation of a state law called HIPAA. In other words, this means a medical practitioner may not under any circumstance break confidentiality unless the patient is a harm to themselves, others, or elderly abuse is occurring. Healthcare executives have a professional obligation to protect their patients' medical information and records, even if they think it is in the best interest of the patient. Healthcare executives also have a moral obligation due to the fact that they can technically still share their patient medical records without their consent. Healthcare providers have a duty to the patient and do what they want. The medical executive is bound by a contract and has no right to share their patient medical information. All healthcare executives should maintain an appropriate balance between the patient's right to privacy and the need to access data to greater help the patient. The patient knows what is best for themselves and their situation. If they do not want their medical information shared, then their reason for that should be respected by healthcare executives. If healthcare providers share medical information without the consent of the patient, it is a violation of the HIPAA law. The only way a healthcare executive can break confidentiality is if a patient is in danger to themselves, others, or elderly abuse is occurring. Overall, the patient knows what is best for their situation and should be respected by the healthcare provider. The most difficult part about the research process was finding credible evidence to support my reasons. I would change the fact that I did not look at more sources than I did. I plan on going to Western University and attend the PA program and eventually go on to work at Kaiser Permanente.